right, so now we've done the overview, and I'm going to go into the different situations and when you might want to use certain items that I have here on the table. So hypothetically, you're walking along through some deadfall and you trip over some deadfalls. It's happened to me a couple times, and you land on a stick and you get impaled. It's not in your chest cavity and it's not on a limb. So there's a saying out there, it's called, they say, tourniquet the limbs, pack the junctions, and seal the box. So junctions are going to be your shoulder junctions up in here, not out on a limb, but not in your chest cavity. And then kind of the crook of your hips in here that's not into your stomach area, but it's not on a limb, so you can't use a tourniquet on it. So you fall, you puncture yourself up here. It's not down in your chest cavity. What you're going to end up doing is that's where you're going to use your combat gauze or your Celox gauze, something that's an impregnated gauze that's got a hemostatic clotting agent in it. So what you're going to end up doing, and there's a lot of videos out there online, I highly suggest going to some of these videos by North American Rescue, and there's a few people out there that demonstrate the wound packing really well. But basically, you're going to end up making a little ball out of that gauze, stuffing it in there, and wound packing is done to basically fill up the void in a muscle cavity that's been created by something, whether it's a knife wound, a stick, gunshot wound, anything like that. So that's why you don't pack the stomach area, just because there's not a whole lot for it to pack into. Your stomach's intestine and everything, you're going to move around so much that packing it, you're going to need a lot of gauze to really fill that to stop the bleeding. But you're going to end up packing that, and then probably taking an Israeli bandage if you can, get it around yourself to put compression on that so you can keep that gauze. And it's going to hurt. You're stuffing something that's got a chemical agent on it to stop the bleeding into a wound. So it's not going to feel good, but it will stop the bleeding. And then you can use your inReach and call for help and get out of there. So the average adult human has about 4 to 6 liters of blood in their body, depending on their body type and makeup and everything. And it doesn't take a whole lot of blood loss before you end up going unconscious and dying. They say about half to 2/3 of your blood in your body before you end up going to that route. So you got 90 seconds, 120 seconds tops before you end up bleeding out to a point where you're just not going to come back for it. Either you pass out and can't keep pressure on a wound, or you end up dying just from blood loss. So having these items in a spot where you can get to them really quickly. I carry that tourniquet right here. I can get to it really quickly, and I've practiced with it enough, and I can't emphasize that enough. Don't just buy this stuff and carry it. You can get practice tourniquets, you can get all these items, you can get regular gauze and practice wound packing, but there's classes out there called Stop the Bleed classes. You could go to your local ambulance company, whether it's a county run company or a private company, and ask them hey, show me how to do some of this stuff. And they're more than happy to do it, most of the time, at least that I've seen. So get some training on this stuff, because watching YouTube videos and just kind of seeing this kind of stuff, it doesn't substitute actual hands-on training with these items. The chest seals, this is something that takes a little bit more time to apply and a little bit more, training. So what ends up happening if you puncture your chest cavity, when you're trying to breathe in, the atmospheric pressure inside of your chest cavity is changing and isn't what it's usually, so you end up collapsing a lung, and basically as you're breathing in, air's coming into the hole that's in your chest and it's collapsing one side. You end up going and getting so much pressure in there that your heart and your lungs quit working and you end up dying. The chest seals, what they'll end up doing is sealing that puncture in your chest cavity and allowing you to breathe normally. And then these ones are vented, so that pressure, that air that has came in already, can work its way out through the vent holes. And I mean, you're in a bad way, you get to a spot like that, but at least This will keep you alive quite a bit longer. If you have something through and through your chest cavity, that's why a lot of these are in 2 packs, but you almost need a buddy there to apply these. Just they're a little bit more difficult to apply on yourself, especially if you have one on your back. But I carry those. Hopefully I never have to use them. But next video we're going to go into how to apply some of these items, some of these different tourniquets, and why you might use one of these tourniquets versus the other, and which ones I choose and why I choose them.